A few weeks ago, our good friend, dermatologist Dr. Batra, showed us an exciting new injection for cellulite on your butt. Check it out.
We have the first and only FDA-approved injection to treat moderate to severe cellulite in the bottom of women. I'm going to start injecting, and you can actually inject up to 12 dimples per side or per cheek, if you will. And it's just a series of 3 shots in each dimple at different angles. It's like Botox for the butt, because we're not filling, we're using this enzyme to do its job under the surface and to break up the collagen. Over the next week, her body is going to reorganize what's called the extracellular matrix, and the tethers that create these dimples are going to release.
Dr. Batra and her patient Shannon join us now. Welcome, ladies.
Thank you so much for having us. Great to see you, Dr. G. Great to see you, Dr. Orden.
Well, Dr. Batra, as you know, the two of us, we've been looking for a cure for cellulite as long as we've been around. And up till now, it has been elusive, right?
Absolutely. And cellulite, as we all discussed, affects up to 90% of women after puberty. So a pretty common problem.
You were one of the first that you were investigating this product, and I'm excited. Let's see some results and tell us what you think of the results you're seeing so far.
Sure. So Shannon had the FDA-approved protocol, which is a series of 3 treatments, each spaced 21 days apart. And so what you can see here is that we injected right into the dimples to release them and bring them up and make them more shallow. And so we have even a close-up photo where we looked at a couple of those specific dimples a little more closely. And what you'll see if you look is that they actually are just much less apparent. They've been released. And so the topography is just less pronounced. And so I do think also that this is quite a nice long-lasting result in that it's been studied for several years after this first series of 3.
Shannon, how was this procedure for you?
It was actually very simple, other than the pain, just a little bit of the injection, which is more like a sting, but it didn't linger. It was nothing. And then Dr. Batra had mentioned there would be some bruising, and she was correct. There was significant bruising for the first week, but after each series, it became less pronounced. So the second week was less, and by the third week was actually even less than that.
And Shannon, have you checked it out? Have you looked in the mirror?
I have checked my bottom out, yes, and I'm pleasantly surprised.
So, Dr. Batra, in seeing those photos, I see a change. It's subtle. Does that mean that Shannon would be a candidate for more treatments?
So there's sort of 2 components that I think you're seeing. There's the laxity component or the loose skin, and then there's the divots themselves or the dimples. And so the subtle difference you're seeing is that those dimples have become more shallow. But I think for Shannon, actually something that would round out the improvement in the appearance is probably something that addresses the laxity or the loose skin, so a tightening device. As you know really well, since you're an expert, Dr. Orden, we've talked a number of times on the show about radiofrequency, about ultrasound, about some of the other modalities. So I think while this is a really lovely tool in the armamentarium for cellulite that really just didn't exist up until this year, it's just one component. And so the dimples look better, but I think we would also think about doing something for the loose skin and the laxity, and that would give her an even greater improvement.
I agree, because the 2 issues do go hand in hand. So who makes the best candidate?
So I think if someone's going to do this treatment as a standalone, the picture you're showing where they're just really discrete dimples without a lot of laxity and loose skin is probably the ideal candidate for this. So certainly maybe someone even a little bit younger who has excellent skin tone, but in a hereditary way just really notices those depressions and are bothered by them.
Well, Shannon, congratulations to you. You look great. Dr. Batra, as always, great work, and thanks for sharing this new information.
Thank you so much for having us back. We appreciate the follow-up.